My name is Ameeta Singh. I am a clinical professor in the Division of Infectious Diseases at the University of Alberta in Edmonton.
What is syphilis?
Syphilis is an infection that can be passed on from someone who has it to their partners by having sex with them, or it can be passed on from a pregnant woman to her unborn child during the pregnancy itself.
Will I know if I have syphilis? How will I know?
That's a good question. So they may not know if they have syphilis or not. The only way to know if they have syphilis is to get tested, and that's with a very simple blood test. And in fact, in the Northwest Territories, all pregnant women are tested for syphilis at 3 times during the pregnancy. Of course, they have to see someone in order to have those blood tests done. In some cases, people can have symptoms of syphilis. And so what the symptoms usually are is it can start off in the very first stage as a sore, which is usually on the genitals. Sometimes it can be on the mouth. And if that stage isn't treated, it can get better by itself. And then about 6 to 12 months later, people can have swollen lymph glands. And very occasionally in this stage as well, people can have what we call neurological symptoms. So for example, they could have trouble with weakness or numbness, tingling. They may have changes to their vision or changes with their hearing. So it's really hard to figure out if you have syphilis or not without having the test done.
Is having syphilis a big deal?
It kind of is a big deal. First of all, because it is preventable completely. Obviously the way to prevent it is never to have sexual intercourse with somebody who has it, but there are other ways that you can reduce your chances of getting syphilis. So for example, you could choose to use condoms. You could reduce the number of partners that you have. You may decide to engage in practices that don't involve insertion, because any of those things could result in syphilis being passed on.
How long can I have syphilis?
So you could actually have syphilis for your whole life and never know it. So how that could happen, for example, is let's say you were born to a mother who had syphilis during pregnancy. You could continue to have syphilis and just carry it in your blood for many years. And very occasionally, you may go through your whole life and never know it. It is more common, however, that people will show some symptoms that they have it, usually shortly after they become infected in the first year or so. And then if that gets better without treatment, then some years later, they can go on to develop the problems of the brain or the nervous system.
What's congenital syphilis?
So congenital syphilis happens when a pregnant woman passes the infection on to her unborn child. If that happens, a number of things can happen to the infant. The infant could die before being born, or the infant could go on to deliver normally and very occasionally will have very severe manifestations, meaning, for example, they could have a very enlarged liver or spleen. They may be very anemic. They may have a peeling rash. So all of these things can happen to the baby. Occasionally the baby can be born looking completely normal, and then some months later go on to develop some of these more severe findings. If left untreated, again, syphilis can cause problems with developmental delay, so learning difficulties, sometimes problems with walking or hearing. So it is really important that all pregnant women be tested for syphilis. And if perchance they're not tested before delivery, then it's really important that all babies are tested for syphilis at the time that they are born.
What happens if I test positive for syphilis during pregnancy?
So fortunately, the treatment for syphilis is very simple. It hasn't changed since the 1940s, and in most cases, it can be treated with a single injection of penicillin. And for pregnant women, they will sometimes receive 2 injections a week apart, but that treatment is usually very effective in preventing the transmission of syphilis to the baby.
How does a syphilis test work?
So syphilis tests are very complicated. So, what is different about syphilis testing is that If we take the example of gonorrhea, for example, if you have a positive test for gonorrhea, just a single test that tells you that you have gonorrhea, and you then go on to be treated. In the case of syphilis, the laboratories do a series of tests, usually a combination of 3 different tests, before deciding if someone has syphilis or not. And because those tests can remain positive for life, those tests really have to be put into perspective with the person's previous history. For example, have they had syphilis before? Did they get treatment at the time? What did their syphilis test show in the past? So it's a little bit more complicated trying to figure out with syphilis whether you have an active case of syphilis or not, or whether you have just an old case of syphilis that's been adequately treated in the past.
Will my doctor tell anybody if I've been diagnosed with syphilis?
So under law, in most parts of Canada, if you test positive for syphilis, your doctor is required to notify the infection to public health authorities. But the method of doing that is done in a very secure fashion, and within public health, that information is kept in a very secure way and is only shared with people who absolutely need to have that information. So it will never be made public, or it will never, for example, be told to your partners in this case as well. In fact, when public health, for example, makes contact with people's partners, they will usually say something like, "You've been named as a case, as a sexual contact to someone who has syphilis, and we'd like you to come in and get treated." And oftentimes the nurse who's making that call will not know who the case is, or even if they do know, they're not allowed to tell the person who the case is that named them. So usually the nurse will say something like, you know, at least that person cared enough about you to give your name forward so that you can be tested and offered the opportunity for treatment, because what the treatment will do is prevent your infection from getting worse and preventing you from getting some of those late complications. And of course, in the case of pregnant women, it will prevent the infection from being passed on to their unborn child. Don't be shy, get tested. We're all sexual beings, and it's okay. That means sometimes you're going to get an infection. We have the means to test and treat for them, so just go ahead and get tested.